The next one has to do with whistleblowing. I know there's a lot of whistleblowers going on with the government, but you don't really hear too much whistleblowing in healthcare and medicine. You might hear some whistleblowing in the pharmaceutical industry. It's a little bit more common now, but this is going to be a little bit more nursing related. So a nurse working in a prestigious hospital discovers that some physicians and surgeons are engaging in unethical practices to manipulate patient data, including falsifying medical records and test results. The purpose of these actions is to move certain patients higher up on these transplant lists and make them appear more eligible for specific surgeries, even when other patients may have a more urgent medical need. The nurse is deeply troubled by these manipulations as they compromise the integrity of patient care, prioritize certain individuals over others unfairly, and potentially put lives at risk. However, the nurse fears the repercussions of reporting this misconduct, knowing that the involved physicians are influential within the hospital and may have strong connections with hospital administrators. So this is tricky. So the thing that makes this a little bit interesting is that the nurse knows that things are being falsified. So there is some fake news going on. There's some falsifications of records because there's a difference, I want to say, between falsifying records and optimizing patients. For example, if the patient, let's just say, is not on any inotropes and you're writing down that the patient is on inotropes, you're saying that the patient is eligible in certain ways because these are the labs, but the labs aren't really showing that. That's bad because then you're just straight falsifying things. But when it comes to optimizing patients, when you do, I want to say, certain tests that you know are going to qualify them for these surgeries, even though all the lab results have to be done as well, but you know by doing these, it's going to put them up higher in the transplant list, or maybe putting them on 5 of a inotrope versus a 2.5 of an inotrope, even though you know that they technically don't need that 5, but they do need that 2.5, and it's only a matter of time until it goes from 2.5 to 5, but you're just putting it a little bit quicker. Then optimizing, I want to say I don't really have an issue with, because certain criteria has to be met to be put on a transplant list. The higher you are on the list, the better chance of you getting an organ. So there's a difference between optimizing and falsifying. If you're falsifying because you like this person, you know this person, that's unethical. But if you're optimizing things, then that's not really a huge issue, because they're going to get to that point sooner or later. And we understand that the more time goes by, the longer you wait, the worse things are, and the harder it is for you to kind of bounce back, or the harder it is for you to have a successful surgery. Because, for example, waiting 7 years on a transplant list versus waiting 2 years on a transplant list versus waiting 2 months on a transplant list, your survival rate gets a lot greater. Same thing with surgeries. If we know you're going to qualify for an LVAD in 5 years, because just the way your prognosis is, we've seen this before, and we know that people that have your lab values now, the people that have the same symptoms you're having now, they usually get LVAD within the next 5 years. Sometimes you're thinking and you're like, okay, we know the cascade of heart failure. We know this patient is going to need an LVAD in 5 years, but we know that the earlier you get this LVAD, the longer you could say your heart is functioning at whatever shitty level it is now, the greater chance you have of surviving surgery, and greater chance of you having a happier and healthier life, in a sense. So that's the thing. If you're falsifying records, that's no. You shouldn't do it, especially if it's somebody that you know, all that kind of stuff. But if you're optimizing patients to maybe put a little bit higher in the list, yeah, that kind of sucks, because technically they're going to get this organ before somebody else. But it's a little bit of a gray area. You know, it's a little bit of a gray area, because you know the cascade of things. You've been doing these surgeries for forever now, and you know the prognosis. You know the cascade of what's going to happen next, and you also know that the sooner you get this done, the better the outcomes are. So optimizing, a little bit gray, but I understand. Falsifying, it's a no-no. If stuff being falsified, that shouldn't be happening. I'm sorry. Maybe you want to give this person an organ because you think you're going to save the world. You can't do that because you're lying. You're falsifying it versus optimizing, guys. I know a little bit of gray area. Maybe you guys have some scenarios that you maybe see as a gray area, but big difference between lying and optimizing.